Oxygen saturation imaging as a useful tool for visualizing the mode of action of photodynamic therapy for esophageal cancer. Photodynamic therapy, PDT, is a treatment option for esophageal cancer that produces reactive oxygen species in cancer cells and induces the vascular shutdown effect. Endoscopic changes in the laser illuminated area are very minor immediately after PDT. Therefore, it is difficult to determine if the illuminated area is adequate. Oxygen saturation, OS imaging, can directly measure and visualize tissue oxygen saturation, STO2, of the gastrointestinal tract surface. The aim of this study was to validate the ability of OS imaging to visualize the mode of action of PDT in esophageal cancer. 8 patients with local recurrence after chemoradiotherapy for esophageal cancer were enrolled. OS imaging was performed before PDT, after 100 joules per square centimeter illumination, after illumination completion, and the following day. OS imaging is a novel endoscopic technique that can directly measure and visualize tissue STO2 of the gastrointestinal tract surface. The system uses 2 laser light wavelengths, 445 nanometers and 473 nanometers, to detect spectral differences between oxy and deoxyhemoglobin. The mucosal surface is alternately illuminated at these 2 wavelengths, and the reflected light is sequentially detected with a color charge-coupled device in synchronization with light switching. The obtained images are processed and transformed into a STO2 pseudocolor map. This endoscopy system can simultaneously project 2 images, white light and OS imaging. The case was a 74-year-old male with local recurrence after chemoradiotherapy for esophageal cancer. The lesion was located at the low thoracic esophagus and the clinical depth was T1b. The pathology was squamous cell carcinoma. After APC marking, 2 illuminations were planned according to the size of the lesion. After illumination at 100 joules per square centimeter, OS imaging showed an extreme change in the hypoxic state of the illuminated area, although the change was not visible on white light imaging. The second illumination was performed as planned. After completion of the illumination, the lesion area was covered in blue color. On day 2, we confirm that hypoxia was maintained using OS imaging. This shows white light and OS images on the day of PDT and the following day. We were able to obtain endoscopic images that displayed dramatic changes in the hypoxic status immediately after PDT illumination. Before PDT, the median STO2 value was 61.5% for the 8 cases. After laser illumination, the median STO2 value significantly decreased as the laser dose increased and was 11% after 100 joules per square centimeter laser illumination and 1% at PDT completion. OS imaging can visualize the changes in STO2 levels in tumors before and after laser illumination. OS imaging can be considered a clinically useful endoscopic functional imaging technique that can visualize the mode of action of PDT in real time.